Okay, so today I'm going to cover both the lower and upper extremity. This video is going to have the lower extremity skeleton. So come on over here. We're going to look first at this bone here. The whole bone is called the coxal bone. It's made up of three bones, the ilium, the ischium, and the pubic bone that we're going to cover some details of. Now let's go over some structures. We'll start off here with the ilium, and we have the crest. This is the iliac crest. If we come down here, so another thing is this. The socket tells me I'm on the lateral side, and this bumpy thing here, that's the bone you sit on. It's called the ischial tuberosity. That tells you you're in the back. Pointy part, pubic bone, tells you in the front. So this is actually a right coxal bone. Now, if we go to the posterior side, we have the posterior superior iliac spine, the posterior inferior iliac spine. If we go to the anterior, we have anterior superior iliac spine, anterior inferior iliac spine. And again, those names are just describing on where they're at. If we go here, this is part of the ischial bone now, the ischium. This is called the ischial spine. Then we have this notch right here between the posterior inferior iliac spine and the ischial spine. This notch is called the greater sciatic notch. We go below the ischial spine and we have the lesser sciatic notch. And then we stick with the ischium. We've got this big tuberosity called the ischial tuberosity. And then this arm-like bar of bone, this is called the ischial ramus. Now this is part of the pubic bone, also called the pubis. So we have the superior ramus of the pubic bone and the inferior ramus of the pubic bone. And then this hole is going to be the obturator foramen. The socket itself is called the acetabulum. And let's see, let's go ahead and turn to the other side. So now we're on the medial side. We've got this fossa right here. This is called the iliac fossa, okay? And now let's look at the articulated pelvis too, because we have some more structures we want to look at. We've got the sacroiliac joint. Here's the sacrum, here's the ilium. Can you see that well? Sacroiliac joint on either side. We have the pubic symphysis, which is this little fibrocartilage pad right there. If we go around here, we have what's called the pelvic brim. So if you can see that, this is the pelvic brim. And then we have underneath the pubic arch or the pubic angle, okay? And that takes care of the pelvic bone. Let's go ahead and look at the femur. When we look at the femur, the head has to always be on the medial side. The sockets have to always be on the lateral side. If we want to know front from back, this smooth surface down at the distal end is the patellar surface. That tells me I'm on the front, and this big notch in the back called the intercondylar notch or intercondylar fossa tells me I'm on the back. And so let's go through some structures here. By the way, that makes this a right femur. We've got the head of the femur. We want to specify because there's lots of heads on lots of structures. So we've got the head of the femur here. We've got the neck of the femur. And then I'm going to turn it to the posterior side so we can see these a little bit better. We got these big projections of bone on the medial side, or on the head side. We've got the lesser trochanter, and on the lateral side we have the greater trochanter, which is this right here. Now, one that can get a little confusing, if we drop underneath the greater trochanter, right around here, spiraling towards the center, we have what's called the gluteal tuberosity. It's not super well visualized on here, but this is the location. And then as we come from this through the center, so center this way and this way, as we come through, we've got the linea aspera right in the center there. And then we'll slide down to the bottom, and we've got condyles. Now, if you look back up here, right, we got the head on this side, so this is the medial side. So if we slide down, we've got the medial condyle, which is this big portion of bone here, and the lateral condyle. And epi means upon, so we have the the medial epicondyle, and let me sure get the right angle, and the lateral epicondyle. Okay, so they sit upon the condyle. So lateral, medial epicondyle. And then we said this is the intercondylar fossa. We already said also this, patellar surface, and we're good with the femur. Now we've got the tibia. This portion down here, this is called the medial malleolus. The reason I cover this first is to show you that this has to go on the inside of the ankle. This is the inside portion of your ankle, so that's got to be the medial side of the bone. We look up here, this bump on your shin, that's the front. That's called the tibial tuberosity, which makes this a left tibia, okay? That's got to go on the inside, that's got to go on the front. If we look at the top, this thing here is called the intercondylar eminence, which fits in that intercondylar fossa. As we come down the front, we've got this crest of bone here. This is called the anterior crest, sometimes called the anterior border. And we already said medial malleolus, that takes care of tibia. When we look at fibula, it's this thin, long bone, but we don't want to confuse it with any bones in the arm because, again, look how long it is, right? This is not going to be a forearm bone. So we have two sides. We got the head, okay, and then we have the flatter portion down here. This is called the lateral malleolus. This is actually the outside portion of your ankle. Two things to help us identify we're on the lateral malleolus. It's thinner, and it also has this little notch that's going to articulate with the talus of the foot. When we look at the foot, we've got, here's the talus, okay? And so we've got the talus here, and the heel bone sits on top of the calcaneus, right? This is where the Achilles tendon or calcaneal tendon would insert. And if we go anterior to the calcaneus, we have the cuboid. If we go anterior to the talus, we have the navicular. If you look here, we've got three bones. So again, this was the navicular, this was the cuboid. We've got these three cuneiform bones. This is the medial cuneiform, intermediate cuneiform, and lateral cuneiform, which can also be called first, second, and third cuneiform. When we look here, now these are all foot bones. These are tarsals. These are all foot bones. These are also foot bones. These are called metatarsals. We have the first, second, third, fourth, and fifth metatarsal. We always label starting with number 1 at the big toe. When we look at these are phalanges. Those are your toes. And for the first, you only have a proximal and a distal phalange, but you got to give me the number. So it's first proximal phalange, first distal phalange. For number 2, 3, 4, and 5, we're going to have a proximal, middle, and distal phalange, and then of course give me the numbers. And that takes care of the lower extremity.